the Actors Guild of Nigeria has launched a health insurance scheme for all its members. They've also signed a memorandum of understanding with a health insurance firm in order to be able to provide these services to all actors. So we're trying to figure out exactly how this works, how it is going to be underwritten, how many people have to opt in order for it for the system to work, and if, of course, participants, that is actors and actresses in Nollywood, will be able to afford this. Joining me to discuss this is Monalisa Chinda. She's an actress, Nigerian actress, film producer, media personality, and she's going to give us some insights on exactly how this works. Thank you so much, Monalisa Chinda, for joining us on the Global Business Report. So to kick things off, what was the thinking behind putting this together for Nollywood actors and actresses?
Well, thank you for having me, by the way. Well, it's just about love, love for the guild, love for the members. We've seen a lot of our members rise to their peak, and something just cut their life short. So we have seen this happen all the time, and we decided to come together, have a re-evaluation of how we can put this to an end. Having our members going on social media, asking for help. We've been putting so much in this industry. They have entertained Nigerians in their homes. I mean, somebody had to get up to take up the mantle to do something. I mean, leadership of the East Asian believes that this is the way forward for our members. So to whom much is given, much is expected. Hence the reason why we decided to do this. And thank God people are responding well to this health scheme.
Okay, excellent. So who's underwriting? Who's going to be underwriting the scheme?
Medical health management, and in conjunction with the home healthcare as well. They're the ones underwriting this. Yeah.
All right. And so what about the costs? What kind of costs are we looking at?
Well, we have ensured that the basic comprehensive plan is absolutely affordable. The basic plan is about 1,850 naira. We have the family plan, which is 6,600 naira. We also have the premium plan for EXCO members like me, which is 16,000 and some fraction, 500 naira or so, 500 naira or so. So, you see, the thing is, it covers everybody. It covers the low income areas and the highest income areas. So that is the good thing about it. But then you need to at least pay 3 months, 6 months ahead. So just in case you need to use the card for non-medical benefits, so that can also cover for it as well. So it covers everybody. Okay,
great. So sounds good. And there's been a lot of emphasis on healthcare with what's happened with COVID-19. There's the CACOVID, the Coalition Against CACOVID-19 initiative, the This Day Isolation Center in Abuja, and the number of people that have been taken care of there. I believe the NNPC building healthcare centers across the country, the central bank's healthcare initiative. So healthcare has been a big topic this year in Nigeria across the board. But I do want to ask you, has there been any research done with regards to how many actors or actresses have to opt in order for the scheme to be able to cover everyone? Is there any do you have any figures there?
What do you mean figures?
So as in
there's no list. It's a robust thing for everybody. It covers everybody.
Right.
There's no list for that. Yeah. So what this present administration has done is to every actor to be able to access all forms of treatment. Surgeries can be taken care of home and abroad. Common illnesses like typhoid, like malaria, to more complex illnesses. So this particular scheme is big enough to cover every kind of illness. If that's the question, I hope I've answered it.
Yeah, well, yeah. So the thing is, if only what I was getting at was that if only 100 people opt into this scheme, is that going to be enough? So the schemes have to be funded, is essentially what I was saying. So does it have to be 10,000 people, 100,000 people, 200,000? That's what I was getting at.
Yes, yes,
Okay.
definitely. The cover is quite robust. Yes,
Okay.
we can do that.
So, okay, I do want to ask, though, about as far as affordability is concerned, because, and I want to tie this in with, I guess, how COVID-19 has affected Nollywood, with the number of, I guess, shooting being delayed, whether or not, because acting jobs have been disrupted by the pandemic, if you feel what the cost level is going to be something achievable for, Nollywood actresses and actors in Nigeria.
It will be achievable, and where the members are not able to cover up their own expenses, the agent has come up with a buffer plan, to do that for our members. So yes, there's been a portion for that as regard the number of people who have been, this COVID-19 has affected as well. I mean, the creative industry has been the worst hit as far as I'm concerned. This is where we put our little bread on our table. But then we just have to do what we have to do to see that issues like this are restored. It's so important. Even whether COVID-19 or not, it's about time we begin to see to the health issues of our members. So that going forward, that's what it is.
Okay, great. What about the families of members? Does the coverage include that? Coverage includes them as well, yes?
Yes, like what the plan I have right now going on is the family plan of 6,600 naira, which of course covers husband, wife, and 3 children, maybe your mother, father, your relative, your small family. Yeah, so it covers a family of 5.
Okay, great. I want to ask you this. Can we see a system, I'm sure maybe this is going to be developed going forward, but if I want to include pensions here, can we see a system where when studios make payments, I almost see Nollywood actors and actresses as contract workers, where payments are made for work on a movie or a film or a director or producer, that deductions can be made for an HMO, for pensions, and so on and so forth. Is that something that we can foresee in the future?
Yes, it's on the pipeline at the moment. In fact, every member that registers with as low as 18,000, right now it's about 18,300. But we want to up it up a bit to 25,000. So thereby, when you register, we take part of the money to put in these various health management schemes for them. So they don't have to begin to wait till probably when they're out of work or because of age, and then they are not able to afford some of this benefits. So yes, we're actually working towards that. In fact, we've already started.
Excellent. Monalisa, great stuff. Monalisa Chinda, Nollywood actress, producer, and media personality. Thank you so much for giving us information on this HMO scheme by the Actors Guild of Nigeria, and we hope to have you back in a few months or so to check how the progress has come along. Thank you so much. And
thank you for having me.